today on our third educational series event. We're happy to be able to provide this level of education and to really share with you resources in the community. I'm Bonnie Danker, and I am the owner of CarePatrol in the Howard and Montgomery County areas. And we have 7 franchises in the Baltimore, Washington area. And I'll kind of go around the room. Charles Picard is Prince George's. Amy Fager on the top right of my screen is in the Lower Eastern Shore area of Maryland and Delaware. Bonnie Elliott, Carol and Frederick and Loudon, Virginia. Robin Edwards is in the Northern Virginia area. Paula Sotier is in the Baltimore metropolitan area. So we're thrilled to be with you today. CarePatrol consults with older adults and their families and helping them find the right assisted living, memory care community, retirement community, or independent living community, as well as other resources to help support older adults and their families in the community. Our services are provided at no cost to you. We consult with our families and their loved ones, helping them understand what options are out there. And that's at no cost, whether or not you move forward with any of our recommendations. Each of us are really the local expert in our area. And so it's wonderful to be able to have that type of local resource at your fingertips. We're very local, we're hands-on, and we're with you every step of the way. Our process really begins with us meeting with you virtually at this point predominantly, although we do still meet in person with protection meetings. And we help understand your financial, your medical, and the social type environment that you would like to live in. Our clients refer to us as matchmakers, matching your needs with the communities. Most importantly, we're in and out of these communities every day, so we're able to give you the most up-to-date information on their clinical capabilities, their COVID updates as to who's accepting COVID residents and what their policies are, visitation policies, and their most recent state surveys. So very, very important information, as we know we're all trying to understand how to best support one another and what those policies might be, or an indicator as to which communities we may want to really consider looking at. Our team is in and out of these communities, as we chatted about, so it's really real-time information, and it's so essential during this pandemic. We've had to pivot, and we're doing a good job of that by providing you with both in-person as well as virtual tours, and we're working very closely with our providers so that they can really get you the most important information, and so that you can see what these communities look like. We assist every family every step of the way, in addition to our niche, which is really in that assisted living arena. We also have a lot of local resources, everything from home care services to elder care attorneys, and many other providers who we can connect you with so that you can make these transitions and really get your answers to your concerns and your questions. In fact, the team before you, as you see before you, has placed over 2,800 clients in over 960 communities over the last few years. So we really do pride ourselves on going that extra mile and being that local sage in the community. So we welcome you today, and we look forward to serving you. We're available 24/7. So even over the holidays, you have questions or concerns, please do reach out to CarePatrol so that we can help guide you.
Great. Thanks so much, everybody. And I've got on the screen, you can see the different CarePatrol locations. I also cut and pasted all the contact info into chat. So we're real excited to have everybody on board, and looking forward to our audience making connections with you. So again, thanks for putting this series together. I'm thrilled to be the moderator, and I am going to now bring on our featured speaker, who is Heather Suri, an aging life care manager. And let's see here. Let me get Heather on. And while I'm bringing Heather on, I just want to remind you that these are monthly. And so next month, it's on December 9th, the CarePatrol team has put together a presentation with Teresa Guintini, who's a doctor of physical therapy, on 10 ways to prevent falls amongst seniors. So that should be a really good one. So let me stop sharing my screen and welcome Heather. Heather, it's great to have you here, and we're all looking forward to hearing what you have to say today. I've known you for years, but give the audience a brief overview of your background and what you do as an aging life care manager.
Absolutely. Thanks so much, Steve. And thank you to CarePatrol for inviting me this morning. So like Steve said, I'm an aging life care manager. I also am a nurse. Been a nurse for, I think I did the math this morning, 23 years. I've always worked in the community and community-based settings. I held a certification in hospice and palliative care, so that's a strong area of interest to me. But I opened my care management practice almost 3 years ago, and just the Aging Life Care Association is so active in this area and is an amazing group of professionals. I'm very active with the association on the board, and excited to talk to my community this morning.
All right, great. So I'm not going to hold you back any longer. The topic today is communication frustration, advocating for seniors in the age of COVID-19. So I'm going to drop off the screen, but before I do, I just want to remind the audience that at any point in the presentation, if you've got a question, type it in to the Q&A box that's at the bottom of your screen. And then once Heather runs through her presentation, you'll be able to raise your hand and we can respond to you that way. So I'm going to drop behind the curtain here, Heather, and if you want to share your presentation, we will get this started.
Okay, sounds good. All right, folks. Well, before I forget, I also want to just wish a very happy Veterans Day to those in our audience today who may have served, or your loved ones who may have served. And here this morning, we're here to talk about communication, frustration. A lot of the work that I do as an aging care manager is helping to facilitate communication, to coordinate care, or helping families get the information that they need, whether it's from their medical providers, home care companies, assisted living, skilled nursing centers. This has always been a challenge, but especially now during COVID, it's been especially difficult. So today, what I'm hoping for us to talk about is just to kind of do a high-level review of communication and what it is. I want to talk about care professionals and the impact that COVID-19 has had on us. Talk about communication challenges and opportunities. I want to touch on building partnerships with your care providers, and then talk about practical strategies that have worked for me in communicating, and also hear from you what you have found works for you. So getting started, what is communication? I know this seems very basic and it's something that we all know, but I find that it's helpful for me to review and to remember that we often think of communication in terms of the information that we share with others. We communicate with someone else. And especially when we're feeling frustrated, we're not getting the information that we need, or we feel like communication is not working well, then we get very focused on the information that we are sending. So maybe you've sent an email and you've asked a question multiple times and not had it answered, or you made a request and the request didn't happen, it wasn't granted, and so you wondered if it was ignored. So you sent the information, but equally, and in some cases even more important than the information you are sending, is that the information was received on the other side. Communication doesn't happen without both of those parts. So we know we communicate verbally and non-verbally. There was some popular research done in the 60s, which suggested that nonverbal communication made up for 93% of communication. That research, still widely cited, is now thought to be inaccurate. Now we think it's more around 70%, but it's still very largely loaded on the nonverbal communication side. So when we communicate verbally, that's the words that we're saying or the words that we're writing. But everything else, our body language, our facial expressions, our eye contact, the tone, the volume, the pacing of our speech, all of that, how we modulate our voices, all of that is nonverbal communication. So what that means for those of us who are trying to communicate during the pandemic is that we have a little bit of a problem, right? We're not in the same room a lot of times as other people, or if we are, we have a mask on. You can't see my facial expression if I have a mask on, or if we're emailing or we're on the phone, you can't see my body language. You can't connect with my eye contact. So all we have is our words and our voice. Zoom makes it a little bit easier with the facial expression, but that's not how I have the majority of my communications. So there's a lot of barriers there. The speed, the volume, the pacing, our spoken words is more important now than ever. And in an email, we're even more limited. So we have to use very special care in how we use our words to convey some of that lost nonverbal communication. So switching gears just briefly, and I think you'll see as we go on how this ties in for me. Kind of taking yourself out, whether you're the family member or you're the care manager, the advocate, if you kind of put yourself into that role as a care professional, which many of you in this audience are. So I'll be interested to hear whether you relate to this. But, we're seeing a lot of anxiety and a lot of stress in our care professional population. Many of you may have been on the webinar with Dr. Bill Mansbach last month talking about anxiety, that the topic was anxiety in the older adult. But as a sidebar, he talked about COVID-19 and anxiety and how that has impacted specifically healthcare professionals and care providers. So we are seeing the evidence supports that there's a lot of hypervigilance around infection control. Care providers are kind of carrying this stress and anxiety around, are they able to protect themselves? Are they able to protect the elders who are in their care? Are we doing it right? The recommendations have changed. Are we doing enough? That's always running in the background for the people who are responsible for caring for our loved ones. Just the PPE for those folks who are wearing a mask the entire day, and in cases where maybe, especially in skilled nursing or in assisted living, where people are maybe moving in and under quarantine, and we're having people gown and glove every time they go in the room. PPE is hot, and it's not easy to just go get a drink of water. We're seeing, real physical effects of lack of hydration, and all of that ties into anxiety symptoms as well. And then sleep disturbance. There's a tremendous amount of stress, and people aren't getting, as quality rest as they did pre-pandemic. People who work in this industry. So we have to remember that that this is real, and it impacts care professionals in ways they realize and in ways that they don't realize. And I think it's important to acknowledge it, because often the professionals, the care providers, the people that we are talking to, are probably the most stressed that they have been in their career since March. And you may be stressed as the advocate, and there's a good chance that the elder you're advocating for is stressed. So though our work as advocates for patients and clients and family members is of critical importance, we also need to extend each other some grace. This time that we're living in is not normal, and we are not all at our best. So moving on to communication challenges, and this list is certainly not exhaustive. These are just things that come up every day in my practice as I'm working with families and with home care companies and with care communities, with skilled nursing facilities. The in-person visits are limited or not available. So often families could come in and visit anytime they wanted. In some cases, they might stay all day. There were things they could do. You could refill somebody's water jug before you left. You could help them get a snack. You could flag down a nurse for a pain pill. There were all of these little things that families or visitors could do to advocate there in real time and in person. And I think the most important thing that is missing for families especially is that reassurance when they can be there and put eyes on that person. Even if there are challenges or concerns, they're there. They know what's happening, the good and the not so good. And it has, provided them with a sense of control that is now really lost. Another challenge is that our information is often one-sided. I run into this on a daily basis. So what happens is a family member maybe calls their loved one or does a FaceTime with their loved one, often in the evening, maybe at the end of their workday or after they get home from work. And they hear from their parent that the aide was rough during the transfer, and the soup was cold and it had no flavor, and they had to stay in their room all day and there was nothing to do, and everybody wears a mask and is in a hurry and they're mean and they're mad, and it's this kind of download of negative information. And then the family calls in a panic because the information they're getting is one-sided. They're not understanding that in most cases, and those of you who work in care communities will know exactly what I'm talking about, that maybe that individual attended to activities and maybe they ate and enjoyed everything else except for the soup, and maybe everything in their day was great except for they had one rough interaction with one staff member, and now that has kind of colored or feels like all the time. And so the families don't have this kind of balanced idea of what's happening, and that happens to me too. Sometimes I get contact from clients with all of these concerns, and I can get a very unbalanced idea of what's happening in the community. So we have to keep that in mind. It's a significant challenge. Staff are busy across the board, busier than they have ever been. They are adjusting to a changing landscape. They're trying new things and rolling out new protocols and then changing them when they don't work. Many companies and communities have really been trying to kind of figure this out as they go along. So there's been a tremendous amount of change, and the staff are experiencing that alongside the elders and the families. Staffing changes. I've noticed this too, especially at the peak of the pandemic. Those who are especially in leadership positions and direct care staff at that time, there's a tremendous amount of burnout. It was very, very scary time for communities that were dealing with outbreaks. And so we did see people leave or change roles, or bring in new team members, sometimes multiple new team members, and the roles changed because the needs of the residents changed and the needs of the buildings changed. So not only, where maybe you had a community that had the same team working together like a finely tuned machine for years and years, now all of a sudden you've got new people who are learning how to work together, and maybe their job responsibilities have changed and who's responsible for what. So they're juggling that in the background too. And they're doing their best to meet our elders' needs. So I hear this a lot from families too. Well, I sent an email and nobody replied, or I called and nobody's picking up the phone. And I can guarantee you in, 99.9% of cases, it's not because the staff is all in the back room, eating bonbons and having their feet up. It's because they're on the floor, doing their best. I hear this from all of the communities. It's all hands on deck. Because of the changing needs of the residents that the social distancing has made necessary. People all the way from the top leadership positions down are not at their desks as often as they were, and are not as available to respond to email communications and phone calls as they were, because in a lot of cases they're doing the work, the important hands-on work that needs to get done. And then of course the little things fall through the cracks, but the little things we know are not little things to families, and often not little things to elders. They're the things that really support quality of life. But the communities have really needed to, and the companies, home care companies and skilled nursing facilities too, have had to focus on, the most important things, the critical things, safety, being a big one, safety for their staff and safety for the elders who are in their care. But it's the little things that I hear the most from the families, that the families feel the most stressed by. So that is a lot of challenges. So moving on to opportunities, what I think are things that we should consider if we're trying to improve communication with the companies and the communities and the facilities that our loved ones or our clients are, where they're receiving their care. And I'll tell you kind of what works for me and the families that I work with. First of all, finding the method of communication that works best for the staff. So you might have an adult daughter, whose job involves being in front of a computer all day, and email works best for them. But email might not work best for the director of nursing, who she needs to communicate with, or who I might need to communicate with. So I could send 50 emails a day, but if I'm not getting a reply until 3 days later, that's not working for me. And it's certainly not working for the nurse on the other side that is having to sift through my increasingly frustrated emails. It's not a good way for us to facilitate communication. So my way of looking at it, as a family member, I'm concerned probably about one aging parent or one aging loved one. I've got one person. Even as a care manager, I probably have fewer people under my umbrella than a director of nursing at an assisted living or at a skilled nursing facility has. So I'm going to do my best to find the method of communication that works best for that staff member. Setting clear expectations. I think this is probably one of the most important things. It's the care provider's job to anticipate the needs of the elder, but it's not their job to anticipate my needs. It's not their job to read my mind. So I need to be really clear about what I need for them, from them. If there's going to be a good chance I'm going to get the kind of communication back from them that I need. I'm also an advocate for going directly to the person who can solve the problem. If you have a relationship with an executive director, that's great. But if you try to funnel all of your needs through that person, and then they have to delegate out from there, there's just a greater chance of something getting lost in translation. So if you have a communication need that can be resolved by the activities director or by a staffing coordinator, then going directly to the source of the person who can answer that question or solve that problem is going to be more efficient and is probably going to cause less ripples of stress and work on the staff's end. And then somebody very smart once told me, inspect what you expect. That's something that has stuck with me and seems to be true over and over again. It's if you have asked for a change and a month later you find out that the thing you asked for wasn't changed, then you were probably part of the problem. You need to follow up. You can't make assumptions, especially if it's something that is important to you. So that follow-up, I think, to confirm that your message, your communication was received on the other end, that they understood that you were clear with what you asked for, whether it was information or something to be done, to not assume without that follow-up. So building successful partnerships. And this picture here, I can tell you, is the happy, happy face of every director of nursing and executive director who ever gets a call from me, right? They're always very, very happy to hear from me. Not always, but I do have kind of some strategies, and even when we have some rocky beginnings, when I'm working with a company or working with a community trying to iron out communication challenges, we usually, I've got a very high success rate of getting to a good place. So the first thing I do is try to lead with successes. When things are rough, maybe an important ball has been dropped or trust has been damaged, or maybe it's just a new place or a new staff member and it's kind of uncharted territory. You're trying to figure out how to work with someone new. I always try to start with something positive. If I do that, it's more likely that I will be heard. It's not always easy, especially if you're starting from a place of frustration. And it's something that I try to be very, very intentional about. But always find something good and start with that. And be realistic with your expectations. This is something that I do a lot as an aging life care manager with the families, where sometimes their expectations are really not realistic. And sometimes on the other side, working with the care community, they want families to be happy and they want residents to be happy. So sometimes we see that dynamic of kind of over-promising and under-delivering, and that helps nobody. It doesn't help the care community. It doesn't help the families. It doesn't help the elder. So I really try to dig down and understand what is realistic for the company, even if it's not what the family wants to hear. But find out what's realistic and then try to start from there, bridge the gap from there. There's a much greater chance that you're going to be successful if the expectations are realistic. and being clear about concerns, focusing on the objectivity is so important. I often ask families to set goals for their family members when whether we're working with a home care company or we're in a community, to kind of dig down and understand what's important to them about their loved one's experience when I'm advocating for them. And I often hear from them, well, I want my loved one to feel happy. That's nice. We want everybody to feel happy too, but feeling happy is really subjective. So we need to drill down and understand, what does happy look like? How will you know that your loved one is happy? And trying to turn those into more objective statements, goals that are a little more measurable. Maybe happiness is evidenced by someone attending activities every day, or maybe they are able to share with or without cueing a positive thing that happened that day, a positive interaction with a staff member, a positive interaction with another resident. I have found that when I can get families to do that and share that with the community, then that's something the community can really execute on, because it's very specific and it's very concrete, and it sets everybody up for success. And then always ending with appreciation, even when it's hard, even when that interaction has been difficult or communication is not going smoothly. I think at the end of the day, we all have to understand that everybody's doing the best they can, and care professionals, especially, they're under extraordinary pressure, and they're doing the best they can, and it's important work, and we need to value it, even when things aren't going smoothly. We need to offer that appreciation. That's something that I feel very strongly about. So practical strategies. So these are things, kind of concrete things that I do that I think really help improve communication with families, with care providers. One, and maybe it seems silly, and if you're a care community or a home care company out there that I work with, and you don't like how I do this, you can tell me. But single thread emails. So often I will have a family member send an email that's got 10 different subtopics in it, and then they get upset that only 4 of those issues were addressed. And it's just too much. It's information overload. And maybe each of those items needs to be addressed in a different way, in a different time, by a different person. So I think it's very helpful to kind of chunk your email threads by topic, so it's easier to track the flow of information. Another thing that I think is tremendously helpful, and I would love it if all companies and all care communities would do this, so I don't have to cut and paste your pictures off of LinkedIn to make my own scrappy copies. But families need color pictures of who you are, what your name is, what your role is, what you're responsible for, what they should contact you for, and what your contact information is. I do this pretty routinely for families, just throw something together in a Word document, and they really, really appreciate it, especially because now they can't come into the building, and a lot of people, have been moving into care communities or getting started with home care companies. And there's so much that is done by phone and virtually these days, or with PPE. It gets, people feel disconnected. And it's difficult to really build those foundations of communication and relationship when we can't put names to faces. So just a one pager, it's a simple thing that makes a big impact. I like setting up scheduled meetings. I'll tell you, I've not ever had a care community tell me that it was the best idea ever, and most home care companies either. But usually, once we get started, it can make a big difference. So, I think that if you've got someone where there's a lot going on, a lot of communication barriers, or maybe there's medical complexity, or other things that are going on with their care, where we're just seeing advocates and family members get really escalated, trying to schedule those meetings and I really work with families on, triaging. If it's something that's urgent, you call or send an email. If it's something that's not urgent, then we work and hash it out in a scheduled meeting, monthly or quarterly, depending on whether that's appropriate. And it ends up saving the staff in the care communities some time eventually, because they're not dealing with kind of these families' perceptions of what's an urgent situation on a daily or sometimes multiple times a day basis. And it's a lot easier to kind of talk that through by phone than having the question and answer come back and forth through email. So that's something that has worked really well for me, especially since the pandemic. And then, the personalized positive reinforcement. I have a client in a care community who was just going through a really big rough patch, and there was a caregiver who made her a cup of tea just how she liked it, with the right amount of sugar and the lemon on the side, and went out of her way, to bring it to her unprompted. And it meant so much to my client. It was a little thing. It didn't take a lot to do it, but it was a very big thing to my client. So I made sure to go out of my way to let everyone in the building know her name, exactly what she did, and how much I appreciated it. We need to celebrate those wins and really make sure that the people that we are collaborating with know that we don't just see the problems, that we also see the things, the little things and the big things that they're doing to take care of our elders. And really, folks, that's what I got. I want to say thank you to the families, to the care managers, to the patient advocates for your work. And also thank you to all of the care professionals who are caring for the people that we advocate for. Your work matters. All of our work matters, especially now. And I would be happy to answer any questions or to hear your ideas or your feedback, your observations about what's happening where you are.
Yeah, this is great, Heather. And I loved your suggestion with the cards. I think that's a really great idea. And just an easy one, but one that we just don't think of that often. So really good tip there. So at this point, if anybody has questions, comments, things that they'd like to share, this is a great time. While we're waiting, and you can do that by typing in questions into Q&A or raising your hand, pressing the button at the bottom. But while we're waiting for any questions or comments, just pull back the curtains a little bit between and give us some insight on the daily life of an aging life care manager, sort of like how, what are some of the services that you and your colleagues in your profession provide, and when is it a good time for a family member to reach out and connect with you?
Absolutely. I think that every day is a little bit different. What I see a lot of in my practice are people who have a lot of medical complexity or mental health complexity, and family members feel like they need some expertise, some guidance, a second set of eyes on a situation, almost like a liaison, because I do understand what expectations are realistic in these settings, and can help kind of be the buffer when things are frustrating. The same things that happened to elders before the pandemic are still happening, but it's even more difficult to navigate the healthcare systems now than it ever was. And so I think that many of us got very busy during the pandemic. Hospitalizations are harder. Families can't be there. The discharges are hard. For a long time, even the case managers couldn't be on the floors with the clients. I mean, they were doing all of this case management remotely. It was, it continues to be very challenging, but very creative work. Every day is different.
Great. I'm gonna, Paula raised her hand, so I'll get to Paula, but there's a question that came in. How do you recommend dealing with a client who never seems satisfied, no matter what the situation is? Boy, that's a good one. And that's been happening since the beginning of time. COVID had nothing to do with that. But
Yeah.
Any tips on that expectation versus what's being delivered?
Yeah. So I think that setting the realistic expectations, right? And I think that's one place where an aging life care manager can really come in handy. Because if you are in a care community, or you're a home care company or a home health company, and you go in and say, you need this or you can't have this, that conflict kind of occurs. If you have a third party come in and say, this is realistic, this is not, sometimes it can be better received. And a lot of those, I think there are some people who are just difficult. Care managers work with those people a lot. Nobody calls me because things are going well. But I think really managing the expectations and leading with what you can do and not as much what you can't can be helpful.
Great. Paul, thanks. Good tips. Paula, you have a question or comment?
Yes, thanks, Steve. Heather, you did a wonderful job talking about, how to advocate for seniors. And I just wanted to let everyone know about what CarePatrol does all the time. Honestly, I've been in the business 6.5 years and placed over 1,000 people, my team has. And I think the last 8 months has been the most trying, because our number one important role is to advocate. And we have the relationships with the social workers in the hospitals and the rehab, and we have been that one sort of saving grace to get the answers, because everyone's busy. And I've been really appreciative of what we can do, and I think our team has been our clients have been appreciative of everything we do for them. So if there isn't a time to use an expert like yourself and CarePatrol, this is the time, because everyone is overwhelmed and everyone is stressed out, and they really need someone to hold their hands through this process.
Yeah, that's great. Thanks, Paula. And yeah, I think also a lot of the times when I talk to folks and you hear that there is that they're challenged or they're difficult, it's because they started the relationship with different expectations than what was being delivered. And oftentimes when you go through and you do the forensics, you discover that, well, it was clearly stated, but it wasn't processed, and
it wasn't received,
wasn't received. Exactly. It's so another question here. What is the best scenarios for care agencies to engage you for your services in a proactive manner with clients?
Yeah, just give us a call. Give me a call. I love working with care companies. Again, if you go, and many of you know who the care managers are in the area, but Aging Life Care Association, aginglifecare.org. You can do a zip code search and look for an advanced professional in your area. Yeah, you just reach out to us. Every client for us is different and is individual. Personally, I'm always happy to brainstorm with my senior serving colleagues. I know Robin Edwards and I do that. Robin with CarePatrol have brainstormed together about clients. So I'm also always happy to try to give you an idea or get you pointed in the right direction, whether or not my services are right for you or your clients.
Great. Well, this has been a great conversation. So what I think I will do to just kind of close things out is ask the CarePatrol team to come back on the screen. You guys can just go ahead and take your cameras off and join Heather on the screen, and we can kind of close things out with any questions or comments that anybody would like to make related to the topic today, or any other topics for that matter, with the time that we have, with the last few minutes we have remaining. Yeah, so I think we've got a fair amount of CarePatrol folks in the audience there. You know, Heather, and this is applicable to CarePatrol as well, the scenarios that I find helpful to bring an advocate in is oftentimes it's whenever somebody calls me and they start it with, my sister thinks that we should do this, I think we should do this, but my brother thinks we should do this. I'm always sort of like, okay, you needed an objective third party to jump in and navigate these waters.
Yeah, I've got a client with 7 adult children and they're all involved. So Zoom has been a great tool to kind of get everybody on the same page. One thing I just like to throw out there is, and I can speak for my practice specifically, but how I work with CarePatrol with my clients, because of course, Aging Life Care managers also help families find placement options. However, a lot of times I'm working with families who have a breadth of complicated needs. There might be geropsych types of situations or a lot of medical complexity, other things that really tap into my clinical expertise. But an important kind of mission of my practice is to always make sure that I'm being a good steward of my clients' financial resources. And, in finding a care community, that can be especially for a family that needs a lot of hand-holding. That really is what is in CarePatrol's wheelhouse. And so I know that Robin and I have worked together that way in the past, where I kind of managed the things that were really under my clinical umbrella. And then she was able to help tour my families and kind of give them that very high touch experience and working within her expertise, her expert knowledge of these buildings. And it has worked out beautifully for some of my clients before. I felt good about what I was able to do in that partnership. So.
Oh, that's great. No, I'm glad you sort of shared one approach to professionals collaborating together. It's that's really good. So let's see. Let me whoops, Bonnie. Okay, hold on. Okay, I got a message from Bonnie Elliott that she's not in, but Bonnie, I'm doing my best here to try to find you. Oh, there we go. Okay. And
There we go.
okay. So anyways, well, any closing remarks for anybody on the screen right now as we kind of wrap up another session and get prepared for December 9th, where we're going to have Teresa Gutini is going to be the presenter. Are we good, guys?
I would say on behalf of Care Patrol, we appreciate everyone coming today and taking part in this webinar. Heather, it's been really very insightful. And I think over the upcoming months, we'll continue to work together and collaborate because it does take a village. And we all have the ability to brainstorm together and to come together because as we all know, we're going into a surge, and I think more minds are better than one, and we have wonderful partners in the community. So I would encourage anyone here on the call and your colleagues and friends and families to please feel free to reach out to Care Patrol and to Heather, because I think you have a wealth of support and knowledge in the market.
Yeah, I agree.
Great.
Thank you so much, Heather.
All right, guys. Well, this has been wonderful, and thanks to all of our attendees. And we'll send out a follow-up with the recording to everybody. So have a great day, and a great remainder of the week. And we got the holiday season is coming forward. All this content that Heather provided us with, which is very valuable, because there's going to be some challenges and some frustrations within our families as we move into the holiday season, whether people are connecting or they're not connecting, or doing that. So all right.
Thank you, Steve.
All right,
You
thank
bet.
you.
Appreciate it.
Have a great day.